So I came over the injury that I want to talk about today while I was in the clinic in preseason. Now, most of the athletes were coming in and they were complaining of having low back problems, and I didn't understand why they were having low back problems because they're playing soccer, and I didn't know at the time why their back would be hurting. And then my preceptor mentioned to me, or talked to me about mechanical low back pain. Now, real quick, can I get a show of hands from everybody in here if you've ever had, raise your hand if you've had back pain before. I'm not surprised by this because most people in their lifetime will experience mechanical low back pain, but they don't know exactly what it is. It can be defined as pain, stiffness, or muscle tension above the gluteal folds, and it can be with or without leg pain. But the most important symptoms of mechanical low back pain are pain and disability. Now, mechanical low back pain can be diagnosed by the patient's walking gait. You want to look for a Trendelenburg gait, which means that the hip will be hiking when they walk. And then you want to check for limping. You can also check for FRS, which is flexion, rotation, and side bending on the side that is affected, or extension, rotation, and side bending, which is also on the side that is affected. In the history, you want to check to see if the patient has a history of scoliosis or any other spinal conditions, because this can lead to having mechanical low back pain. Now, when you're palpating, you want to palpate along the spine for fractures or to see if the spine is messed up in any way. You want to check the SI joints because pain along the SI, or if the hip is out of alignment, that can also lead to low back pain. And then you want to check the soft tissues around the low back, like the paraspinals, the glutes, and the QL. Pain on all of these. You'll feel tightness, muscle spasm even. And you want to also do some special tests like the Faber special test, Gansling's, or leg length to check for SI dysfunction or hip, and check for hip alignment. You can do straight leg raise tests to check for disc herniations along the spine, but we'll get to that later on in the presentation. Now, conditions I want to talk about that go along with mechanical low back pain would be sports with excessive rotation and extension can lead to a condition called spondylosis, which is where a stress fracture occurs along the spine. Now, this condition, if left undiagnosed and untreated, will further develop into a worse condition called spondylolisthesis, which is where it's stress fractured and it's also dislocated. Another condition is any type of pathology to the lumbar spine will change the mechanics and lead to SI stress or SI dysfunction. Now, when you're palpating, you'll feel pain on the glutes or above the glutes on the SI joint. To fix this, you're going to want to try leg length. Alright, to diagnose this, you're going to want to do the leg length test, and you're also going to want to do Faber and Gansling's test. Decreased lumbar motion and a positive straight leg raise test, like I said earlier, will conclude that the athlete patient has a disc herniation. You're going to want to cease activity with them and have them go through surgery immediately to treat this. So, treatments that you're going to want to do with any of these conditions, most of these conditions, are soft tissue work like massage, cupping, electrical stimulation, combo, ultrasound, and stretching. You're going to want to work on the paraspinals. You're going to want to work on the QL and the glutes. And if the patient is having SI dysfunction, soft tissue work will also help with that. And you're also going to want to check the hip alignment to realign those. And if it's out of alignment, you're going to want to realign the hips by shotgunning. And the patient's pain will decrease for a time. It may go out of line again, so you're going to want to keep checking on that. You can also try spinal manipulation. This can help with decreasing the pain. It can also take load off the SI. It can also work with the soft tissue work will also take weight or take pressure off of the spine. You also could try rest with athletes or with patients that aren't very active. Rest can also decrease their pain. And it can also work with athletes too. But if they're in season, you want to do the quickest possible way to get them back out on the field. And in research, I found a topic called the abbreviated measure stretching technique. And this technique has been known to work. It's not very effective in an athletic training room, but in a in a clinic, like at a physical therapy clinic, this would be a perfect way to decrease mechanical low back pain. What you're doing is you're suspending the patient in the air with ropes. So you're going to have like a safety belt going around the waist, and then you're going to have ropes going up through the arms, and they're going to be kind of hanging like a rag doll in the air with their gravity pulling down on their legs, stretching out their low back. And as time goes on, you're going to want to add weight to their legs so the back gets more of a stretch. After 10 to 15 minutes, you take the patient off of the suspension and you want to lay them on their side for 5 minutes to rest and get their back into and just to relax, pretty much. And then patients said that they noticed immediate relief on their back, everything. Like I said, this is more for a physical therapy clinic, though, not an athletic training room. It's not very practical. So after this, all of these treatments can be used to decrease mechanical low back pain and prevent injury. Thank you.